How's it going, guys? Past level question, hematology step 1, internal medicine 2CK. 38-year-old woman who has a 6-month history of fatigue, and we have this blood smear here showing us obvious our rods. Okay, so you can see these needle-looking structures within the leukemic cell. It's past level, as I said, and then I'm just asking what you're going to see in this leukemia. Okay, we'll talk about as we move through. So choice A, cytoplasmic projections, wrong fucking answer. This refers to hairy cell leukemia. Probably 2 questions tops on all the NBMEs combined, and they're hyper easy. They'll give you a slide where they show you projections from the cell that look like hair, literally, and they'll tell you in the stem there are cytoplasmic projections. The answer is just hairy cell leukemia. It's not dramatic. Wrong fucking answer. Choice B, lymphocyte predominance, wrong fucking answer. Would refer to ALL or CLL. Okay, so if you get a stem, they tell you the patient has leukocyte count of 60,000 and it's 89% lymphocytes. Lymphocytes should be 25 to 33% usually, okay? So you see it's 90% lymphocytes and it's a kid, let's say 8 years old, that's ALL. It's an adult, that's CLL, okay? It's really that simple. They can throw in other details. I mean, you need to know leukemias are almost always B-cell in origin. If they give you a kid and they tell you there's a leukemia where it's CD10 positive, TDT positive, I mean, you're talking low yield details, that's also ALL. They can give you plethora, which is facial redness, which can be seen in an SVC-like syndrome if you have TAL, which is a T-cell ALL variant where you get a thymic lesion. We're talking lower yield stuff here, but the point is, if you get a leukemia and it's a school-age kid and it's all lymphocytes, like 90%, that's ALL. If it's an adult, it's CLL. Wrong fucking answer. Choice C, 50% blast, correct answer. Diagnosis AML, acute myelogenous leukemia. This is what they're going to do on the USMLE. They're going to either give you this very buzzy image of the R rods, you know, instantaneously it's AML. Don't get obsessed over M2, M3, okay, the notion of, 15, 17 translocation, acute promyelocytic leukemia. You should know acute promyelocytic leukemia is a type of AML, okay? And you're going to get these R rods, which are composed of myeloperoxidase. When you treat AML and you can give all trans-retinoic acid, high-dose vitamin A for the APL variant, you can produce a disseminated intravascular coagulation with schistocytes. So you have to be aware of that as well. So the question, if they don't show you this image, they can just say, you've got an adult who has 30% blasts, 50% blasts, and you're like, what does that even mean? Okay, well, that's AML, okay? So you just get myeloblasts, and you can eliminate to get there, because as we talked about, ALL will be a kid where it's all lymphocytes, CLL will be an adult where it's all lymphocytes, and then CML, which I'll talk about, which is going to be Philadelphia chromosome. So choice D, wrong fucking answer. CML, Philadelphia chromosome, 922 translocation, BCR-ABL. That produces an oncogenic tyrosine kinase, also known as a fusion protein. You have to know this terminology. But they'll give you an adult who has all different myelo-sounding cells. So say myelocytes, metamyelocytes, promyelocytes. 4 out of 5 questions, when you see those myelo-sounding cells, it's CML. 4 out of 5. Sometimes it's not CML, but it will be obvious if it's not. Okay, I don't want to go down a big digression right now, but CML is going to be an adult with myelo-sounding cells, metamyelocytes, promyelocytes, myelocytes. AML is going to be an adult usually who has 30% blasts, 50% blasts. They can show you the our rod's in the image here. ALL is a kid with all lymphocytes. CLL is an adult with all lymphocytes. The treatment for CML you could be aware of is imatinib. Okay, it targets BCR-ABL tyrosine kinase. Choice D, wrong fucking answer. Choice C, smudge cells, wrong fucking answer. So this is CLL. Okay, so CLL, as I already harped on, some extra details. Which, by the way, smudge cells are exceedingly low yield. I think maybe 1 question in history where smudge cells are even mentioned, the fragility of cells if they're viewed under light microscopy. You could be aware of cells that are CD5 and 23 positive for CLL. I mean, we're talking like minutiae here. You can get a warm autoimmune hemolytic anemia, so you can get antibodies against RBCs. Wrong fucking answer. You know, to make more content with my subscribe channel. Appreciate your time. That's it.